Sí, maybe also.
I just want to welcome everybody here tonight and to the event that we're about to have. My name is Austin Saunders. I'm the president for MESA, Mission for Environmental and Social Awareness, campus group here that is working in conjunction with Oregon Rural Action and also Healthcare for All Oregon, two other organizations that are working in conjunction for bringing us this event. And to speak on behalf of those, Tyler Whitmire is here as the vice chair of ORA's Blue Mountain chapter to speak about ORA, and then Cheryl Simpson Whitaker will be up here to speak for a few minutes about Oregon, Healthcare for All Oregon, and the Healthcare Reform Act.
What we want to do, one of our primary missions is sustainability. Sustainability not just of the environment, but of the economics and sustainability of all sorts of stuff around this region of the country. We're all aware that this is a beautiful part of the country, and so ORA helps bring that passion to action. All sorts of things we work on, like healthcare, which is the focus tonight, but we also work on sustainability as far as farming goes. We have some farm to fork programs. We have farm to school programs. We help out with the farmers market. You may have seen Chef at the Market this year. Did anybody get to try out the cuisine that was being prepared down there? Yeah, come on, everybody ate some of it. Okay, so that's a lot of fun. We're also worked on the solar heat program, some solar power programs. So we have a broad range of programs that we work on. Again, it is volunteer driven. So it depends on what the volunteers want to do, what we focus on. We have Soul West, which we are lucky to have adopted. It's going to be coming to the Grand Ron Valley next year. It's going to be out at the fairgrounds, I believe, right? So we'll be out at the fairgrounds. It's been going for quite some time, but it's been down in John Day, right? And so we have been allowed to adopt it, and it's going to be coming here to the Grand Ron Valley. That'll be good for us economically, but it will also be good for spreading the sustainability message. There's going to be all sorts of great exhibits down there about solar and, just, well, Soul West. That kind of describes it for you. I won't get too much more into it. But if you have the opportunity and you're not already a member, we would like you to sign up to be an ORA member. You get all sorts of wonderful emails about events like this and opportunities for engagement. We'll let you know about the community garden when it comes up, so you can get a community plot over at the garden beside EOU, or you can help out with some of the other community gardens we have around the valley. Like there's one out in Union now, I believe, that's getting going, and there's a couple others across the valley that we can plug into if you are interested. Without further ado, we have excellent. There you are. Cheryl's going to come up and talk a little bit about the Healthcare Action Team from ORA.
Well, I'm delighted to see you and to have 3 or 4 minutes to share something that I find personally very exciting, and that is healthcare movement in Eastern Oregon. In January of 2012, a state coalition was formed. There is a long history, so they have been working on healthcare, universal healthcare, for a long time in Oregon, but it created itself again as Healthcare for All Oregon in January of 2012. Shortly after that, ORA became one of the first 25 members of the coalition. And I can report that I just found out today that we're now up to 89 member organizations. are here with the Healthcare Reform Action Team is a group of very committed people that are excited about the notion that there will be a day in Oregon when absolutely everybody has the health care they need. And we believe that the way that will happen will be at the point in time when there is a universal, publicly funded healthcare system where everybody is in and nobody is out, and there's 1,000 slogans that give the message that we believe everybody deserves quality health care. So who are we? There are about 400 people in Eastern Oregon in our database, including Pendleton, and we've got Dr. Frank Erickson from Pendleton tonight. There are about 400 people that have signed and they believe that universal single-payer health care is the way to go in Oregon. And then there's a smaller group of about 40 that is part, and the 400 are in our database and they're on mailing list. Then we have about 40 that are people involved in the action team, and about 20 that come out routinely. The other 20 are episodical depending on what we're doing. So there is a good core of people involved. Our issue is to educate, to mobilize, and raise funds. And we do that by holding community events, education, mobilizing. Part of what is happening out with Fuji and Jim in the tabling is sharing information and giving you an opportunity to participate with us. Our Healthcare Reform Action Team meetings are open to anybody that wants to stop by and listen to what's going on. And we meet on the third Tuesday of the month from 6 to 8 p.m. at the ORA office, which is 1119 Washington. And you'd be more than welcome. Anybody on the way out, if you can stop at the table and talk to Fuji and Jim for a few minutes and make sure you leave your information, we'll put you on a mailing list. So, a couple of images to leave with you before I sit down. Well, this isn't an image, it's information that 60% of bankruptcies in the United States are related to medical bills. And the majority of those people had health insurance. That's a statistic that's very commonly known. Over 500 Oregonians die each year because they cannot afford treatment. We did a survey, actually an EOU business class had a civic engagement project, and students interviewed 128 people and asked them questions about their healthcare experience. Many people said that they stayed at jobs they hated because of health insurance. One person is paying off a $9,000 emergency room bill, $20 a month. The one I want you to leave with, because it is the crux of why we believe we need to have a new way to provide health care for everyone, is the person that signed. You were supposed to summarize your experience, and it was child buried $35,000 in medical bills.
Okay, so next we're going to be watching a short healthcare video that lasts about a half an hour, and it was a video that was made in Oregon, and it compares and contrasts the Canadian healthcare system with the United States. Panel of speakers come up and speak a little bit about different things within the healthcare industry, and then we're going to have a question and answer session with the audience to field any questions with the panel of speakers that we have. We're going to have Dr. Frank Erickson, who's a radiologist from Pendleton, who's driven out here. He's going to be on the panel. And we're also going to have Beth Stewart of Valley Insurance. She's going to be on the panel, and she's going to be speaking about the Affordable Care Act and a little bit just introducing Cover Oregon, which Lisa Ladendorf NEON, the Northeast Oregon Network, is going to be talking about the Federal Oregon program and how their nonprofit organization helps enroll people in Federal Oregon.
You don't want the microphone?
Yeah.
It's wireless if you want to. You're good.
I don't want to see that. So if you want to take about 20 minutes or so to talk about it.
Sure. I'm Frank Erickson, I'm a radiologist in Pendleton. I've been in Oregon since 1994. And I got involved with the Madison Doctors in 2009, inspired by the movie Network. A lot of you aren't old enough to remember that movie, but in a newscaster in a newsroom says, Madison, I'm not going to take it anymore. It encouraged his audience. It's like NBC News, right? To go open the window, stick your head out, and shout this out in the air. And there was over frustration with things that should have gone differently. As Paul Hochfeld said, it was May 2009, where Senator Baucus was holding a hearing about how to reform healthcare. And this was shortly after President Obama made the speech where he said, we want ideas from everyone. We want all things to be on the table. Please come and tell us how to do this. He's trying to be inclusive. Senator Baucus, whose chief aide was a woman executive from the insurance industry, who actually wrote a lot of the legislation, decided that he would pick and choose who could sit at the table. And of the slew of people from the pharmaceutical industry and the health insurance companies and the hospital associations that he allowed to sit and give testimony about how to reform healthcare. There were 8 doctors who formed Physicians for a National Health Program. One of whom was Steffi Wohlhammer, a pediatrician, who had applied a month before as required to get time at this caucus, at this meeting, and they were denied. They said, you can't attend, you can't sit down with us. They came to the hearing anyway, and said, they stood up and said, wait a minute, you're not allowing this point of view to be expressed. This is not an open hearing, as was advertised, and they were rejected by the Capitol Police. And they're called the Baucus 8. Senator Baucus ordered the Capitol Police to have them expelled, rather than allow a single pair to be discussed as an option. This caught the attention of a lot of the medical profession, including me. Finally, I got politicized, and I'm just saying this to explain why I'm in front of you now, and why Madison Health Doctors joined the coalition, which is now known as Healthcare for All Oregon, which has 90 members. Different organizations that got together, some of whom are unions, like Oregon Nurses, SEIU, and Jobs with Justice. Basically people who think that working people deserve a break. From the doctor's point of view, I think everyone deserves a break. I think that I'm looking at this as a scientist. I'm basing my opinions, what I'm telling you tonight, on outcomes. And imagine that you're in a university on a bioethics committee that looks at human experimentation proposals. And a professor comes up and has this plan. He said, well, we want to do this experiment. We want 3 groups. One group is the group that we're going to treat them like it's pre the Affordable Care Act. We want them to get their health care like it was before. The second group is post-Affordable Care Act. We treat them like, like it's been in, like it's 2017. The third group is a single payer group. For, everybody's universality, no co-pays, no preferred provider lists, no restrictions on getting access where you can get it. So the committee would say, well, what's the potential here? Well, the choice is, as the committee member, the first group, 50,000 deaths per year. The second group, somewhere between 25,000 and 30,000 no debt security. In that scenario, how long would you let that experiment go on? In the medical profession, when we have a clinical trial of some treatment that can save a life, and you're going on trial and you have a control group and a test group, if you find out in the middle of the trial that whatever it is you're testing is actually very effective and is saving the lives of the test group, you stop the trial. You don't continue to let the control group die and suddenly discover this miracle cure. Okay? That's not ethical. It's not moral. So it's turning into this big moral argument. When we passed the bill in Salem to at least study the issue, see what our big accomplishment was in 2 years. House Bill 3260. We're going to, the state of Oregon, the governor signed it. We're going to test. We're going to have an examination of how which financing method is the best method for Oregonians. That was considered a victory. The lady that in the movie who was the oncology nurse who had gone to Canada rather than stay here, she's expressing frustration. There were multiple efforts over the years in Oregon to try to pass a single risk pool universal coverage kind of plan. They all failed. And it's because of, lobbying efforts with interests that are vested that really want to stop this. Anyway, I'll come to the point about the Affordable Care Act here in a second. The way we're looking at this is having failed twice now to pass our most recent 2 bills to provide affordable care for all, health care for all Oregon, have taught us that you really have to get everybody aware who is a potential voter. We have to convince them that it's in their best interest to do that. Business people, working people, everybody. The fact that they passed the Affordable Care Act is now sucking all the oxygen out of the room in these discussions because it's capturing everyone's imagination and attention because it's the thing that you're having to deal with right now. While we go through this, what I call the ACA era, and feel the effects of it, I want you to think of what we should be doing, what we could be doing. Keep that in the back of your mind. And remember that universality is a good goal. It has positive health influence on how long we live, how long our neighbors live, how well our businesses will do, whether people want to come to America for vacation and spend money with us. There are Canadians who are afraid to come here, not just Canadians, but other people from other countries. They're afraid that they'll be sick here because they know that we wouldn't take care of them because they can have a credit card, or should need. And we'll take care of their emergency problem, but we won't. They'll get bills. Like our famous case in Pendleton, the 10-year-old who goes on a sports trip and gets E. coli from beef jerky, ends up with kidney failure, has to be life-flighted to Portland from Pendleton. One way, it was $23,000. This was on top of the $30,000 or $40,000 for staying in Dornbecker for a couple of weeks to get healed and save his life, from the renal shutdown. This was in a family with 2 full-time employed parents and good health insurance. So we're not just talking about the people that don't have any insurance. We're talking about people that have underinsurance. And you may think you have insurance, which is a segue into what's happening now with ACA. You think you have insurance, but if it isn't really going to cover you for what happens to you, are you really insured? Okay? You can have a $2,000 to $10,000 deductible insurance plan, right? This is what they're offering. Deductibles are going way up. And if you get sick, what are your bills? If you haven't gone through this, you don't know. And you have no clue until it hits you. And when you get a bill from a hospital for multi-thousands of dollars for just a few visits, a few days, and plans don't qualify because they don't really cover you well enough. Those people are getting upset because they then have to pay more. And the government doesn't cover all of the difference. So yes, there's a subset of people now applying for care under the Affordable Care Act that is going to cost them more than their old plans do. And they're irritated, that's understandable. I'll say just a little more and then hand over to Mike, but when Medicare was implemented in the 60s, it took 6 months. It was done with index funds. It was simple. Ralph Nader likes to say, the bill that Tommy Douglas got passed in Saskatchewan is 8 pages long. The doctors objected, they went on strike. Lawyer Taylor came over, they negotiated, okay, we'll fix it. We rewrote it, 13 pages. Doctors went back to work. They were happy about it. Nader points out that if something is 900,000 words, it's written not for the people of the country, it's written for the lawyers, okay? It's because it's too complicated, they made it that way intentionally. So I'll leave it at that. And I'll stay as long as anyone wants to talk about questions about more details. The thrust of healthcare for all Oregon now is just to reach out to the public, try to stay organized, try to keep in the background until it becomes very obvious that this is not going to work out the way people thought it would. It might take years to find this out, but we're going to be there when time comes and we'll say, let's revisit this and think about it. There's one chart I wanted to show you before I quit. This is something called Prezi, and you see at the top, this is just an internet site. This is called Prezi.com, Prezi.com. You can go there, it's free. You can log in with your Facebook ID, or just log in straight into the Prezi.com site. And I made 3 Prezis. This is one of them. It's titled Healthcare for All Oregon. You type in the title in the search window, it'll take you to this. Another one is Healthcare Reform, Single-Payer Healthcare Reform for America. And the third one is the timeline of healthcare reform. It reflects a lot of the details you saw in the movie. But the way this works is it looks like a PowerPoint presentation that uses the same kind of slides, but also uses YouTube videos online if you're hooked up. And it doesn't make you go slide by slide. You can zoom out and zoom in on this and know exactly what you want and watch it is. This is what we call the data crunch. We're living this right now. The insurance companies have responded to the Affordable Care Act by raising their premiums because they know in 2025 that the income of a family of 4 will equal on an annual basis what they're going to charge you for their health care insurance. When that happens, that means that family of 4 has no money left over for anything else if they pay their health insurance premium. And that's one of the major failings of the Affordable Care Act is that there is no cost control for kindergarten. What's unique about Oregon is Governor Kissow went and got $2 billion pledged to support the coordinated care organizations. Our version of the Affordable Care Act implementation. But he had to promise that he would not allow the rate of rise of premiums, the costs, to go over 1%. Keep it somewhere, hopefully less than 1%. A year later, he's actually kept that promise. So it looks like a victory. But that's the rate of rise. It's like acceleration is 32 feet per second. You still crash. And the ACA is not going to change this curve. It's still going to meet. They might even be faster. If the insurance companies panic, they might. They'll raise it faster. My wife runs a medical office in Pendleton. She's the only urologist. She has 4 employees. She was facing ODS versus Pacific Care and Pacific Stores and Moda, you know, and she's trying to, every year, a business owner has to look at those premiums and decide which plan they're going to stay with. They're asked to revisit every year. They don't know what the cost is going to be. So she ended up choosing 13.9% increase this year. The year before it was 11%. And there's no telling. When you do that to a business, a small business, they start making hard choices. So if you can do what Walmart did, you say everybody's half time now. You no longer buy into health insurance. Or you can have a conscience and you just have to, your overhead gets bigger and bigger and bigger. This doesn't induce anybody to come to Oregon and open business. And that's one thing, we dream, our big thinkers and South doctors, we have this fantasy that CCOs will succeed and that businesses like Nike will say, well, we want to buy into the CCOs. We don't want to pay Blue Cross. And the CCOs would be so successful and so efficient that they would have only maybe 5% over. They would act like right. The downside of this is that the hospitals and the insurance companies jumped on the CCOs. They seem to be in a controlling position. And some of the doctors groups are saying, wait a minute, this is not how it's supposed to be. So there's already cracks showing. They're about beginning to worry people, this is not going to happen. This is going to happen. I'm sure some here have more knowledge of this than I do. But I would say sustainability, universality, affordability, all those are wonderful words, and I'm afraid that this is a house of cards, and I'm afraid it's going to start crumbling, and probably before 2025. But thank you for this.
Can you hear me? If I talk, I need my hands, so the microphone doesn't work. Can you hear me? Okay. I'm Beth Stewart with Valley Insurance. I'm one of 2 owners of the insurance agency. I've spent the last 10 years in the health insurance business. And so what I want to do today is just give you a quick rundown on the Affordable Care Act, what we're dealing with now, and then I'm going to hand it over to Lisa, who's going to talk a little more about the specifics of signing up for cover ordered. The Patient Protection and Affordable Care Act is actually 2 acts that were signed into law in March of 2010. That was 3 years ago. Okay, we call it the PPACA, we call it ACA, we also call it ObamaCare. Okay, and as this group knows well, it's not a single-payer government plan. What the government's done is set up some parameters that every health insurance plan has to contain. Okay. The large groups, the 50 and over employees or employers have a little more flexibility, but every small group employer, okay, a small employer is fewer than 50 employees. That's 95% of the businesses in this country. And a single or individual or family plan, that's if you don't get coverage through your employer and you have to go buy your own plan. There's some parameters that every plan has to contain, okay? Things that there's not a plan on the market right now that would meet those standards. So everything changes for next year. But again, it's not a single payer government plan. You're still going to buy your health insurance from private insurance companies. And it's all the same names out in Eastern Oregon, and we've got a new co-op. We have a couple new co-ops in Oregon, so a new company as well. 6 months after the act was passed, several provisions went into effect and have been in place for the last 3 years. Things like your preventative care is now covered in full if you follow some restrictions. And no child under 19 can be denied coverage. Okay, that's huge. That's huge. That's been in place for 3 years, but the main provisions that are taking effect for January 1, right around the corner. One is just about everybody is required to have health insurance. There's several exceptions, but the bulk of the people need health insurance. 2, nobody can be denied coverage. This is huge. I deal with people every day who can't get coverage. They have to go to the high-risk pool. Oftentimes they can't afford it. But something as simple as acid reflux right now gets someone denied coverage because it's now tied to esophageal cancer. So this is big. Nobody can be denied coverage. Nobody will have a pre-existing waiting period, okay? All the plans right now, if you haven't had prior coverage, you are not covered for any pre-existing condition for the first 6 months of the policy, okay? That all disappears. Medicaid is being expanded, okay, from 100% of the federal poverty level all the way up to 138% of the federal poverty level. Medicaid is the low-income program, the coverage at no cost. That's going to include about 240,000 Oregonians to the current Medicaid rolls of about 650,000. That's a lot of Oregonians, okay? And then, of course, the biggest thing which you see all over the news right now is every state has a new health insurance exchange. Oregon's is called Cover Oregon. And Oregon is one of about 15 states that had it together and opened up their own exchange. All the other states are relying on the feds, okay? And as you know, that website isn't working properly. Either is Cover Oregon, okay? Most of it's working, but the real-time application is not working, so we've resorted to Plan B for right now. So, if you're not covered by your employer, you have 2 ways to buy health insurance next year. One, either direct to the company, like we do right now, or through Cover Oregon, the new online marketplace. That's where tax credits and subsidies are available to individuals and families who qualify. And the tax credits are very generous. A family of 4 making up to $94,000 as a household income would still qualify for tax credits. Now, as we're running people through and running the numbers, we're finding the older crowd, my 55 to 64-year-old clients, are seeing much larger tax credits than the younger crowd, okay? Because the formula has something to do with your income and how much you're allowed to pay for that health insurance. And of course, the younger crew, their health premiums are much lower than the older set. But one of the things happening for January is health insurance rates are being narrowed. The rate structure is being narrowed to a 3-to-1 ratio, meaning the oldest person can't pay more than 3 times the youngest person. Well, right now we're at 5-to-1 in Oregon. So what that's doing is it's narrowing the structure. We're seeing the littlest impact to the older crowd and the largest impact in rates to the younger crowd, okay? So as those rates narrow down, we're seeing the younger crowd getting hit with the higher increases. Now, at Cover Oregon, 2 ways to get help. If your family qualifies, the household income comes into play and the number of people in your household, okay? And some of it gets a little more complicated because it's, you know, who mom and dad are still cleaning on their tax returns. It's a little more complicated when you start with older kids. So there are tax credits available that you can actually take each month to help bring down your premium. And the feds actually send the tax credit to Moda Health or to Pacific Source. Pacific Source turns around and charges the family the smaller premium. So you don't have to wait for the end of the year to take those tax credits if you don't want to. Now, so a family making 138% all the way up to 400% of the federal poverty level would qualify for some kind of tax credits. The lower income, if you're making no more than 250% of the federal poverty level, and that's why I've got those, the table outside on the, or the flyer outside on the table. If you're making no more than 250% of federal poverty level, you will also get help bringing down co-pays, deductibles, and out-of-pocket maximums. And we're seeing on some families, we're seeing these $2,500 deductibles come all the way down to $750. And when the median household income in Union County is just under $41,000, we're seeing lots of families qualifying for this financial assistance, okay? So it's been real interesting. I want to speak to the out-of-pocket maximums on the plan. The Act is full of several consumer protections, okay? Bringing down out-of-pocket maximums, eliminating all the internal limits to various benefits. All the protections in the Act refer only, however, to the benefits on an in-network. You know, every health insurance plan has benefits in-network or preferred providers and out-of-network. Those docs that do not have contracts with insurance companies. All the benefits or all the restrictions go to in-network, and the most any person could be out of pocket is $6,350. So if you ended up in surgery with a $50,000 bill, the most you're going to pay out is $6,350. Okay, that means all of those $7,500 and $10,000 deductibles that are on the market right now are disappearing because that's over the $6,350. Okay, so but when you take these out of pocket, there's a whole bunch out there. I have clients on that are $12,000, $15,000 out of pocket, and you bring it down to $6,350, you cut it in half, yeah, there's a rate impact to that because the plan's a better plan. You got to beware of those benefits out of network because the companies all did a little something different, and some got way too high in my mind. But anyway, so lots of changes going on. We're trying to run as many people through Cover Oregon as possible. Our hands are a little tied, we're handicapped because the website isn't working the way we'd like it to work. But I think that gives you an idea. I could talk forever, and I'm going to stop there. And I'm going to have to head over to Lisa.
Okay. Can you hear me all right, or would you like me to use the microphone? Okay. So this is all very confusing. But my name is Lisa Ladendorf, and I'm with the Northeast Oregon Network. We're a nonprofit health collaborative working in Union, Baker, and Wallowa counties. And our mission is to assure access to and quality of integrated health care for all residents. Towards that end, we have involvement in a number of different aspects of healthcare reform, working with both state government, statewide partners, local healthcare providers, social service agencies, and the public. And what I would say is that healthcare reform today is a very, very confusing prospect. It's very challenging to understand. One of the reasons for that is that healthcare has got to be probably one of the most broken sectors in our public and private corporate life that you can see today. Highly expensive, highly broken in the sense that there's a lot of research going into it without the desired outcome visible. One of the things that our organization really strives to do, and we have a couple beliefs, and one is that action is, in most cases, better than inaction. So attempting to solve problems will get us further than not attempting to solve problems. And the second is that there's a lot of power in local communities. And that's really one of the things that we work with our communities to do, is say, okay, what are the potential solutions in front of us now? And the potential solutions that we're looking at today might not be the same solutions that we're looking at 3, 5, or 6 years down the road. Not only is change messy, it's stepwise. So what we have today with the ACA, the Affordable Care Act, will have improvements for many people over what has previously been there. It's also very clear for those of us that are working in the weeds on it every day that it's not the final solution that's going to be a good solution for our communities and the individuals in them either. So it takes all parts and all folks across the sector of the community, those who are out in front working on the ultimate change, and those who are working to help our communities benefit from the changes that we have now. And that's one of the things that we've appreciated with our partnership with ORA is the ability to do that. So our organization is how we connect and relate to the Cover Oregon piece is we are a community partner grantee. We have a one-year grant from the state of Oregon that allows us to hire staff that are on the ground in Union, Baker, and Wallowa counties to provide free assistance at no charge to community members to help navigate the Cover Oregon enrollment and assistance process. We only have this funding for 1 year, and so we're trying to get to people as fast as we can to get as many folks as we can in that period of time. The enrollment process, as Beth pointed out, there are many changes and there are many benefits to many individuals. It's not a simple process, as anyone who's been involved with it knows. We're learning rapidly about all the details of it. And right now, you do need to have someone help assist you with the application. There are certified agents in the community. Beth and her agency is one of those who can assist you. There are community partner grantee staff, such as our organization, and many providers, such as the hospital and a few of the doctor's offices, also have folks trained in helping assist people. One of the things that Northeast Oregon Network does is we do community health assessments. And the last assessment information from our hospitals indicated that 21% of the folks going through the emergency room in our 3 counties were uninsured. And the emergency room numbers are considered to be a pretty good indication of a profile of the need of the uninsured in the population. So we're looking at roughly 21% that are uninsured in our 3 counties. On surveys that we've done with a wide number of folks in our counties, we have about an equal number that are what we might consider to be uninsured. They have the $5,000, $8,000, $10,000, $12,000 deductibles, which effectively mean they can't go to their doctor on a daily basis. They can't afford to do that. So we're really looking at a huge number of our population that could potentially benefit from some of these changes in the ACA right now. We have, Eric, can you raise your hand? Eric Griffith is here. He's one of our community assisters. He's one of the staff that we have that's available to sit down with folks for an appointment, go through the application process, help answer the questions. And what we do is help folks get through the enrollment piece. When it comes back to you, what coverage, what plans you may be eligible for, and what your subsidies are. At that point, folks can say, I want this particular plan, and I know I want it, and they can choose it. Or folks might say, how do I decide which plan to choose? That's the point where we refer someone to a certified agent, where they will have details about in-network and out-of-network and all those details. Like we said, one of the things about these ACA improvements, which can make things better, but still a drawback, is they're very complicated, and an ideal solution would not be this complicated to navigate. However, while folks like ORA and Healthcare for All are working on long-run solutions, there are folks like Beth and myself who are trying to help our local community take advantage of what benefits there are now. So please see Eric or myself if you would like an appointment. He's got brochures, he's got a sign-up sheet where folks are interested. We can call you back, and we encourage you we're available to come, like Beth, to come speak at any community meetings or gatherings, and we encourage all of you to take information and brochures to give to your friends. Because the most important thing is currently with the ACA, it is currently the approved legislative solution, and while it's an incomplete one, all of our taxpayer dollars are going to it, and it's our determination that our local community members will see what benefit they can right now.
You have a question?
Just to start off, I want to break the ice here. Okay. All questions should be encouraged. Nothing's off the table. The matter is held up. But
to learn about Cover Oregon.
One day.
One day, but
For
no,
cover
but
Oregon, no,
for
for
Cover
my
Oregon.
ACA.
No, that's just studying on your own, and I couldn't count the hours.
Uncounted.
It's countless.
Unbelievable.
Sure, that's what I was gonna do. Who has a question? Any question?
I don't need a microphone.
Okay.
Yeah. My voice carries.
Yeah.
Beth, I had a question on Plan B. Is that the one where you have to manually basically print off a copy, fill it out, and send it in?
Yes, although you don't have to print out a copy, but it's kind of a nice worksheet. But if you go to the main website in the coveroregon.com, and on the home page down to the bottom left says Get Started. And it says fill out the paper application. If you click on that, it's going to take you through a few instructions, and there's two options now at the bottom of those instructions. If you want to apply with financial assistance, or you want to apply to Cover Oregon knowing you don't qualify for financial assistance. That's a much shorter application. But you can fill it in online. You have 3 hours to complete it. It's not taking, it's taking us about 25 minutes, depending on how large your family is. But once you submit it, well, and you can't save it, so that's why I suggest you might want to work on it on a worksheet. But we're having a tough time getting through the faxes to Cover Oregon because they're overloaded. So I would go online, fill it out best you can, make sure you print it before you hit that submit button, because once it's gone, it's gone.
It's a PDF.
It's a PDF, a fillable PDF.
And it's really helpful, what can help make that go more quickly is if you have all of the information already there in your head. So if you know how much you pay for IRA contributions and how much you pay for this, how much you pay for that. So that's one of the things that checking out the application first before you go in to fill it out, to make sure that you know all the questions they're going to ask you. Because that's the thing that typically takes a long time, is if you don't know. And you don't want to guess, because you're certifying that this is your best estimate, and if you happen to be really wrong, there will be some adjustments later in the year that you might not like.
Well, and two, what's nice is once Cover Oregon is completely up and running properly, you're doing your best to project your 2014 income. Okay? Some people know exactly what they're going to have. Farmers and ranchers, they know. So you're going to put in your best guess. And then, later on in the year, if you're wrong, and all of a sudden your income's much lower or higher, you can log back into Cover Oregon, adjust your income, which means the tax credits will adjust the following month. Because the whole idea is it all trues up at tax time at the end of the year, and the whole idea is try not to have to pay back a whole bunch of those tax credits. Yeah. So you can adjust.
This, something just came up, you mentioned that you had to know what your IRA, so if you're paying into an IRA or any other kind of a retirement plan on your own, that just like your tax return, it lowers your income.
Yeah.
And then,
Pretty much if you have your tax return in front of you, most of the categories of what you need to fill out on your tax return as deductible, not all of it, but a lot of it will be in the income section. So it's a really good idea to have your tax return and have some idea of what, if you're going to be the same as last year, it's easy. If you're not, then you need to have some idea.
Because they have various categories of income: wages versus social security, wages versus social security, versus even if you're self-employed, they want the gross income. And then you scroll down a little bit and you come to the adjustments. So you take off student loans, and you take off alimony, and you take off what you put in the IRA. And so there's all these different categories. And that's the most complicated part of the whole application, is the income part.
so you want to have a lot of college loans,
It's just the
paying
interest
alimony and have a lot of
on
IRAs, then you get a good deal, right?
Yeah.
Can pay for the system.
Who else has a question? Thomas?
Yeah, I have a question about the last 3 years of things being implemented. obviously they're morally acceptable and we really enjoy them. But as far as capitalistic outcomes, what does that look like with the last 3 years of implementation of the Affordable Care Act?
Well, so I would say that the major provisions of the ACA are not really being initiated until January, essentially. So as far as, and I'm assuming when you say capitalistic, you're talking about what is going to be sort of the wide-scale economic impact?
What does it look like over the last 3 years for the ones that have been implemented?
Okay, the ones that have been implemented. So there hasn't been,
I can speak to that.
okay, go ahead and speak to that.
Okay, because the insurance company, one of the things, for instance, no child under 19 could be denied coverage. A child could stay on their parent's plan up to age 26, regardless of school, marriage, or financial independence. Normally, you get kicked off at 19 if you're not in school, or you get kicked off at 23, or if you get married. So, and then, of course, the preventative services that were covered in full. The insurance companies have always told us agents, we're looking at a 2 to 3% rate impact for those. That's not a lot in my mind. So I think it's been fairly minimal. The biggest changes are, of course, for January 1.
And we don't really know how the cost containment pieces that are the limits to the insurance rate hikes that are in the ACA, how that will impact things. One of the things that they're still waiting to see how it plays out that's really going to affect a lot of this financially is what happens with the younger, healthier population. If the younger, healthier population, we don't get those folks enrolled in larger numbers, it's going to create a fairly unsustainable system. And unfortunately, right now, that's a little bit more challenging, particularly with some, I was just reading an article on how the portal not working is affecting enrollment of the younger population. And there's some sense that having the portals not working nationally is really impacting the under 30 population from enrolling. One good place to go to for a source of ongoing information in Oregon on these types of issues is the Lund Report. It is, you can look it up online, it's a free healthcare newsletter in Oregon, strictly on healthcare. It's a subscription, but it's a free subscription. And the reporters do really a pretty good analysis of Oregon insurance companies, rate hikes, what the insurance commission is doing, etc. And that's a good place to keep up with it on a day-to-day basis.
Lund?
L-U-N-D, the Lund Report. So I think you have to stay tuned. The huge economic impacts are what's coming, and a lot of that's going to depend on